healthy way. My name is Nadine Blair, and with me we have online Dr. Derek Sr. from Doctors to Health, and we also have Dr. Johnson on this morning. Good morning, gentlemen.
Good morning.
Good morning,
Hi, good
and
morning.
yes, and welcome indeed. Now, Dr. Senior, we're going to start off with you. We're going to be talking about chemotherapy and cancer. So, Dr.
Yeah,
Senior, you start off the conversation. I'll bring in Dr. Johnson.
yeah. Good morning. For all the other programs that we have done, we have been telling people or trying to educate our listeners on how to avoid or to prevent certain illnesses.
Mm-hmm.
Now, uh, everybody's somewhat afraid of the word cancer.
Mm-hmm.
So when they hear the word cancer, everybody gets all jittery and uptight. Now, since when it reached that stage when we have cancer, when you have cancer, and you think that there is no way out, there's always a way out. So now that it gets to that stage, what is it that we do?
Right.
That's what we want to try and say. Now that it has reached to that stage where you know for sure that it is cancer, whatever type of cancer it is, we want to try and tell you or educate you on how it is best to support you at any stage. For example, if you're going to get if you're going through chemotherapy and radiation therapy, um, some of some of this stuff, how we can support you while you get that, and that's what we want to talk about now. For many people, the very thought of the chemotherapy can be very frightening. You have in your head that you're the debilitating thing of nausea, diarrhea, vomiting, and weakness, and you are wondering how is it that you can support or enhance your health during that time.
Right.
So
So,
here it
so
is.
it, you're, it's almost like bringing on additional stress, which is not good during that
Exactly,
time.
exactly. So
Right.
sometimes, yeah, I'm pretty sure you have heard of persons who have gone to the doctor, and the doctor says, well, you have 6 months to go or you have a year to go, and nothing happens to them before they hear that.
Mm-hmm.
When they hear that news, that's when
Everything
everything starts
starts.
to
Right.
go down the hill.
Right.
So if they tell that you have 6 months to live or a year to live, because you hear that now and everything was fine up to that point, then all of a sudden automatically start to go downhill. So here's where you're going to come in because we need not fear. There's always something for you to do. So sometimes, if it's chemo, if it's radiation, or even if it's chemo, radiation, and surgery, we have no other options but to engage that phase of our lives and the treatment. So what we want to talk about is what are some of the best about you have quite a number of supplements that you can use to enhance your health during chemotherapy because what's going to happen when you start to have chemotherapy or radiation therapy or just the thought of you start to worry yourself, you start to lose weight, you have muscle wasting, you develop anorexia. So what we want to tell you is that there are other things out there that you can use as adjuvant therapy to enhance your health. So
All
some of the
right.
things that you can use,
Mm-hmm.
you have a high potency multivitamin and mineral,
High
and
potency multivitamin
and
vitamin and
and
mineral.
mineral, yeah. And
Mm-hmm.
so what we want to tell you is that if you can avoid any one of those multivitamin and mineral that without any iron, it will be
Mm-hmm.
best for you.
Mm-hmm.
So we want to have a regular consumption of green juice or green drinks, whatever you
Mm-hmm.
call it, right? Because it is loaded with antioxidants and phytochemicals.
Mm-hmm.
You have what you call mitake and shiitake mushrooms. That is also good, and you have a proteolytic enzymes, and of course the curcumin. So all those, and of course you're also going to use the sea moss, Irish moss, and mix with whey protein. So all these things coupled with chemotherapy, and these that I'm talking about do not affect chemotherapy or radiation therapy in
Okay,
any
so you can take them along with the treatment.
along with the
Somebody
treatment.
Right.
somebody is asking why we're not talking about COVID-19, but I think, it's kind of I don't know. There are persons right now that I know who are facing cancer.
Yeah.
I have friends who are facing cancer, and so COVID 19 does not mean that there's nobody in the world who has cancer. They need answers too.
Right.
And then there's some, and one of the persons I know, it was in a situation in her house fighting cancer and had members of her family fighting COVID.
Wow.
So she was in one room fighting cancer, and across there so is one person, her husband over there, so with COVID, and it was a real issue,
Yeah.
so these will help those in that situation. um and I love that you're saying that it can be, first of all, we've established that stress is not the way to go. And it's probably easier said than done. So finding family support, finding persons to talk this thing through and talk it out. And we believe in prayer. That's important. But also added are these things that you can take along with the chemotherapy.
So, yes. So
Mhm.
so even if you have the cancer. So what we know for sure is that 40% of the people who have cancer, whether they have chemotherapy or not, 40% of them, it is said that they die of malnutrition. Not
Wow.
because they don't have food to eat, but because of what is going on.
Yeah.
They have they lack the appetite, and if you
Mhm.
lack the appetite, then you're not gonna be eating, and you're not gonna absorb. So that's where that
Yeah.
comes from. So we just want you to know that yeah
There is help.
yeah,
There is help.
if you can
Wow.
put together these things and
That
use them, and you have to have the right diet.
That's
So
profound what you just said, that 40% of persons who have cancer die of malnutrition.
yes,
Wow. Dr. Johnson, I hear you wanting to come in. I'm not hearing you clearly, Dr. Johnson. Yes. Yeah.
right.
Mm-hmm. No, you have 2C. Wow. Mm. Mhm.
Exactly.
Mhm. Right. Right. Wow. So eating bad makes it worse?
Definitely. Cancer.
Mhm.
Yeah.
Wow.
These are the omegas. You can find them in a coconut oil, or should I say the cold pressed coconut, or the flax seeds, the fish oils, as I said before. These
Yeah,
oils help to reduce.
and not to cut
Mhm,
you, like as Dr. Johnson just says, good oil. So one of the things that we also know that is that CoQ10 it can be very it very play a very integral role
mhm,
in chemotherapy. For example, if people that are on doxorubicin or hydromycin therapy for
mhm.
cancer, anytime they have that, you have to make sure that you have adequate amount of CoQ10 in their system. So that
Mhm.
you can get that
Exactly.
in the form of a fat, a good oil, a good fat, Q10 with some phytosterols. So because adriamycin or doxorubicin is known to cause it to have a weaker heart, can give damage to the heart.
Mhm.
You
Mhm.
use it so that you can strengthen the heart and at the same
Exactly.
time help you to fight the cancer. Also of importance, equally important, is the similar thing that you see they call melatonin. A lot of people don't know that, but with the right amount of dosage, when you're under chemotherapy or radiation therapy, and you give melatonin, it is shown to help the patient rebound quickly as well.
That helps with
Exactly.
sleep.
Yeah, it helps with
Yes,
sleep,
it does.
but it is
Hmm.
also a hormone that helps and has a lot of phytochemical,
Exactly.
and it's a great antioxidant in the terms, because what you need to know is that once you get proper rest,
Mhm.
your body repairs itself during your sleep.
Exactly.
So that's
Boy.
why you
Exactly.
want to administer melatonin
Right.
when you're
Right.
going to bed.
That is true, Dr. Senior. And research has also demonstrated that healing actually takes place when you have sleep, when you have good, deep, quality sleep.
Right.
It's not when you're up, it's actually when you're asleep where the body has a time to process, eliminate, and repair. And another thing, on the opposite side of sleep, what is also important, and I don't think we are paying much attention to it, is a little vitamin they call vitamin D3.
D
It's
D
Yeah,
basically
three.
D
D as
Right.
in
D.
dog,
Yes.
right?
Right.
D3, right? Now there has been research papers that do correlate low vitamin D3 levels and cancer development. So much so that nowadays you're hearing, even in some ads, the placement of vitamin D3 in their supplements or in their products. Because what happens, is that there are receptors in each cell that recognizes vitamin D3 and in almost every area of the body.
Mhm.
And this now, the vitamin D3 helps in regulation of our immune response and also regulation of our immune system. So if our immune system was underactive, the introduction of vitamin D3 will bring it up to a point where it is deficient, and if it was overactive, it can help it to reduce it to the point where it
Yeah.
becomes normal.
Yeah, you
Wow.
call you call
Hmm.
that you call that it is a an alternative. If the system is overloaded, it brings it
Hmm.
normal, and if it's underproducing, it still brings it normal. But if it's normal, it doesn't make it go up or down. It try to keep
Exactly.
it on the same level.
Balance.
Hmm.
All right.
So
So I have
Right.
two comments here. One person says, after chemo and cancer, I am now sleeping well. And another person says, my friend did stomach cancer,
yeah,
and the stomach is not absorbing nutrients. I
right.
need
So
help.
Hmm.
so
Exactly.
when one of the thing, what this is what you should know, that you see with chemotherapy or radiation therapy,
Hmm.
Mhm.
what it does, it because the cells are, it acts against dividing cells, whether cancerous or not.
Mhm.
So that this means that the lining of the intestine, in the case of the colon cancer or the stomach cancer, in the bone marrow and an ear
Hmm.
follicle, all of which have dividing cells. So the chemotherapy and the radiation therapy has the ability to destroy or damage some of it. So now that she's not absorbing well, so we have to go back and rebuild her
Ah,
so that
Hmm.
she can absorb. So that's why we talk about, the stuff I gave earlier about the multivitamins, the consumption of the green juice, and why a lot of physicians are against natural therapy, because some of them don't fully understand. Only
Exactly.
in the case where you have a person's on Coumadin or heparin or
Hmm.
any blood thinner, you try not to give them green stuff to take, because it's
oh,
going to
Exactly.
affect the clotting factor. So that's
so
what you don't want
Right.
to do.
so you
And
don't
some
just
stuff,
jump.
some
So,
Some,
go
sorry,
ahead.
some supplements in the form of, like, for example, cysteine, one of the amino acid that's in the gut, that can also block the chemotherapeutic agent,
Definitely.
so it make it ineffective. So what you do, you don't give them anything that contains cysteine or NAC, N-acetylcysteine, which is a derivative of cysteine. You don't give
Right.
anything like that. So you wait
Right.
until after chemotherapy or radiation therapy, then you can reintroduce those stuff, because those are very good at cellular repair.
Right.
Exactly.
So
And
that's what we
also,
will need to do for that particular patient. So, just for the interest of time, I just want to leave the little tidbits with them.
okay.
Some of the following dietary suggestions that can help improve your nutritional status in patients that are
Mm-hmm.
going through chemo and post chemotherapy. So one thing that is suggested is that you eat small, frequent meals, like one
Small, frequent.
meal, yeah, like
Right.
every hour, every 2 hours,
Okay.
right?
Mhm.
You need to drink a high protein smoothie or drinks or juice, whatever it is. And it is best we can incorporate whey protein daily with Irish moss. You make a smoothie with that, and that gives you all the amino acid that you need and that your body requires. And it also helps you to keep weight. You don't lose weight. It helps you to
Okay.
maintain your weight.
Mhm. Mhm.
You're gonna have a machine where you do your green juice and your smoothies. You do that daily. You're going to use extra seasoning, spice, but don't use anything that is too sweet or too bitter,
Mm-hmm.
because of the chemotherapy, you have a higher sensitivity to taste. So sometimes the food won't taste good.
Mhm.
And you can
Right.
eat
Right.
soft or moist food while avoiding hard, dry food. So sometimes, if you
Exactly.
notice, they say that I don't have any appetite to eat. But if you give them soft food or you give them moist
They can
food,
have it.
they can have it.
Right.
You gotta take
Exactly.
small bites and chew your food completely.
Ooh.
Mhm.
That is
Right.
Boy, you're
important.
telling you're telling enough things today. Both of you, doctors.
Yeah, so
Right.
that's what we want them to do. And
Yeah.
you gotta
Right.
drink,
Right.
of course, during this process. You're gonna drink a lot of water.
Mhm.
So,
Mm.
like, sometimes you don't feel like you want to eat, but just drink some water. Water is very
And
important. It's gonna help you to get rid of the toxins. It's gonna help your
the
body to get
toxins.
well. You're gonna
Exactly.
hydrate your cells. All these things are very important.
Right. Dr. Senior, you mentioned the point of drinking a lot of water, and I think a lot of us tend to overlook this. This very important. I don't know if we would consider it a mineral. Because really and truly, the best way of eliminating toxins from the body after it is removed from your cell is through the use of water, where it can
Yes.
flush the system. And once you have a functioning kidney, it's advisable that you drink a certain amount of water during the day so that it can pass out all of these toxic elements
Yeah.
from your
And so
system so
that's
that
very
they don't
important, Dr. J, because
reaccumulate.
that's so correct.
Hmm.
What the rule nutritionally, what they talk about is that half your body weight in ounces. So
In ounces,
if
right?
you weigh 40 pounds, they want you to drink 20 ounces of
20
water.
ounces.
Right,
Now,
Exactly.
right.
Hmm.
when you check the nutritional standard, what they have come up with now is that anything that is liquid can also count as a part of water, but it
Hmm.
But
does
not
not
But
all.
negate.
no.
It
Right.
still that you still need water.
Mhm. Exactly. And the next thing too, drinking the water is good, but I also advise my clients or patients that it's best if they're going to have their last drink of water, try to have it about 3 hours, at least 3 hours before going to bed. Because
That's it.
I mean, if you have it too close to going to bed, you're going to be waking up at least 2 to 3 times for the night to pass urine, unless you have very
And
good
that's
bladder control.
interrupting the sleep that you need.
Right.
Exactly.
Hmm.
Exactly. Right. So all of these little things, and the next thing too, Nadine had mentioned something about having a positive attitude. I mean, praying and so forth. That is equally important because the body and mind does work with the mind, the state of mind actually does have an important role on your body as well. So keeping a very positive attitude towards life and towards the fact that you have a creator who can do all things,
Mm.
and realizing that there are alternatives out there that can help you, right? These are supposed to brighten up your day and you maintain your focus on positivity, on the positive.
I think
Yeah,
it's beautiful.
as Dr. Johnson also mentioned, yeah, I remember there was a study that was done, I think somewhere at Harvard,
Hmm.
that shows that people of faith do better in any situation with their illnesses than people that doesn't have or does not express
Right.
any idea of having faith.
Mm-hmm.
So sometimes you can't figure out why is this person still around. I've heard that all the time when I was in the hospital. Why is this guy still around? I mean, everything for him is bad. Every
Yes.
single thing is bad.
Yes.
The stuff is growing. The blood labs are out of range, totally out of range. He's still walking. He's still doing all these things. But then you find out that he has a faith that's second to none.
My God.
And I
Exactly.
think
No
that is
worry
what,
about a thing.
yeah,
Faith that
he
moves
just
mountains.
pray because
Yes.
this guy just
Mm-hmm.
Hallelujah.
he just give it up and just listen to me. They tell me that I have this cancer. I know that I have this cancer, but I'm not ready yet. I have a God
Hmm.
that will
Mm-hmm.
listen to me.
Yes.
And so most of the time you see these guys, sometimes you even wonder yourself. I used to, think about it myself. I'm like, this guy is really, it's like almost to the point of like craziness, because
Hmm.
everything that you're telling this person,
They
it
have a
not,
negative
it's not,
response.
yeah, it's
Mm-hmm.
not coming true like how it is says that,
Wow.
this guy should be gone already. 2 years down the line, he should have been gone 3 months ago. 2 years down the line, you still see the same guy.
Well, you know
Exactly.
what? I said something the other day, and we have to wrap now, but I'm going to ask each of you to just give a closing statement after this. I said something the other day, and someone reminded me of it yesterday. Long live the Queen. Everybody's
Mm-hmm.
saying long live the Queen, and maybe she herself is saying it. There's positivity going in the air and in the atmosphere and so forth. When you remain positive, and we go, I love that we're going biblical now. But when you respond, when your response to something is not, oh my God, me I go dead, oh my God, this is it, oh, but your response is, what can I do, how can I fix this, and the joy of the Lord is my strength, and so forth, it airs better for you in the long run. So find a praise, find a prayer, find a doctor who can help you
Yeah.
in those times. It's so very important. So Dr. Johnson, if you could just give us a wrapping statement real quick.
All right, I'll just state my inspiration from one of the Psalms. For I was fearfully and wonderfully created. And
Mhm.
in that, we have to understand that the Lord God created an intelligent body,
Yes.
and the Lord God has put things out there which are natural based, which are very, very useful and can help us in our journey towards improved health.
Hmm.
Right.
That's good. Thank you. So, folks, you have heard, we talking about this scary, this scary idea of cancer. But listen, we need not fear. There are things out there that you can use to enhance your health.
Hmm.
But most importantly, than anything that you can take, remember that the scripture says, "Remember thy Creator in the days of thy youth," and that when the hard time comes, we'll be able to stand up. So, you know, just keep the faith. You know what you have to do, and continue to do it. Keep your heart fixed on the prize. We all will have to go one day, but this is not the end all. God is the creator of us all, and He
Hmm.
has. My pastor always says He's the Alpha and the Omega, the beginning and the end, the first and the last, and everything that is in between.
Hmm.
He is it. So
Hmm.
listen, folks. If we have God on our side, we are okay.
Yeah.
We don't have to fear anything. Just keep ourselves tuned and fixed and plugged in. And with that, let God make the decision of how your life turn out.
Amen.
Amen.
So again, this is Dr. Stelt. We are at 5 Pause Road in New Kingston. The number is 754-2950, or you can call us at 310-4969. And we are at Witter Village as well at 517-9449. This is the Dr. Stelt, where real people with real problems having getting real solutions. Dr. Johnson, can you give them the number for me, please?
Oh, I'm located at 14 Caledonia Road in Mandeville, and the number is 791-1090.
All right. And those of you who are on Facebook and on and YouTube, we posted all the numbers online so you can see it there. And those of you who are on WhatsApp, if you ask for the numbers, you can get them. I'll be happy to post them. Thank you, gentlemen, for sharing this morning inside the Healthy Way. Have
Thank
yourselves a
you.
wonderful day. Dr. Senior, just a minute, please.
Yes.
Yes, thank you. Thank you so much, all.
Okay then.